so I had met Bob some 37 years ago, not in the context of mayor, but as an executive director of the Washington Bankers Group, and always found him to be a very forthcoming and interesting person to talk with. And I know he did a lot for our city, including helping to really bring aviation to our economy as a big part of Everett, as well as a big supporter of the arts, and worked hard on getting the momentum going to bring the Navy base to Everett back in the 70s. So just want to really recognize Bob and his contributions to our city over not only his term as mayor in the 60s and 70s, but since then as a real supporter of Everett. And that concludes my comments.
Thank you, Councilmember Toohey.
Thank you, Council President Stonecipher. Well, and thank you, Councilmember Murphy. I also wanted to mention the great loss that we have with Bob Anderson, and I was able to get to know him quite well. He and his wife, who's an artist, did a tremendous amount for Everett and as well as the county and the state of Washington, and we will miss him a lot. But his contributions, I think, are going to continue on through the arts and through all the things that he did for our economic development over the years and trade with China. So tremendous person, and we do miss him a lot. So thank you for your kind comments also. Just a couple things. And I'm not going to go too much in this because I know that Councilmember Roberts has lots to say, but I was able to join the groundbreaking of Helion Company Energy, which just broke ground yesterday, and it was really great to hear about that amazing company that's coming to Everett. So I'll let Councilmember Roberts expand on that. I also was able to join Councilmember Bader and the mayor at Forest Park. And if you haven't been up there lately, the whole new playground has been redone, and they had a reopening yesterday, and it's really quite spectacular and packed. It was really packed with kids, so that was fun. And then I also was able to attend the Council of Neighborhoods this week as my liaison, and that's all I have for tonight. Thank you, or this afternoon.
Thank you, Councilmember Vogely.
It's my turn. Let's see. I do have something to say as my computer's falling over. Okay. Yes, the Delta variant is serious, and although your kids may not get it be very sick when they get it, they're still passing on to parents and grandparents and vice versa. So wear those masks, especially if your kids can't get vaccinated like mine. I went to the grand reopening of I was just looking for the name. I'm sorry, I've forgotten, but it's the Scrubs place. They used to be called Scrubs, and they were next to Starbucks on 75th and Evergreen, and now they're next to Ross, essentially. And that is a great company. Yay, I'm just putting a shout out there, and it's awesome that they are in Everett. I was at the Lowell Neighborhood Association, and they had a few questions about the timing and such of the BNSF trains, and I know that we as a city can't really do anything about that, but they're going to be looking into that, and also just essentially safe traffic ways of doing things and double yellow lines. So I think we got some things accomplished, and thank you to Corey Hurt from Public Works. And I think that's all. So everybody enjoy these dry days. Thanks.
Thank you. Councilmember Roberts.
Well, thanks, President Stonecipher. First, welcome Connor Rose. Second, I just want to add my voice to the comments made regarding Bob Anderson. I had a chance to work with him both when I was in DC and here, and he and Donna, his wife, were great contributors to this community and in the arts and economic development in so many ways. So share the condolences and recognize their contributions, his and his families to this community. With Councilmember Toohey and Mayor Franklin, I did have just the joy of seeing a top-notch green energy high-tech company locating in Everett, in Southwest Everett. It's exactly the kind of work that and company that we've been hoping to see there. They were very complimentary of working with the city of Everett, and I just want to say thank you to our team for the work that they did in helping bring Helion Energy here. This is fusion energy, and if they are successful, it is frankly a game changer on the climate issues. The governor was there and made exactly those comments, and so we're keeping our fingers crossed. But it's important to note that they're taking basically the technology now into testing, and they said their hope is to actually be able to produce some commercial electricity through this system. So they've gone from experimental to testing, and if that's successful, they will be moving on to develop at scale. And so this is really, really exciting, and I just was really excited to be a part of that. So thanks to our team for helping make that happen. And that's all I have. Thank you.
Thank you. And I too wanted to express my condolences to Donna Anderson on the loss of Bob Anderson. He was a gem of a person and continued to stay very involved in not only the arts, but other aspects of our community, and will be greatly missed. I also wanted to give a little bit of a brief update on our council reopening to the public, to our meetings plan. As you know, I've been talking and working with administration on alternatives for that plan, and we will be briefed next week at our meeting on that. Deb Williams and Nicole Weber in the mayor's office have done a lot of good work on that. I'm sure working with a lot of the technology people, and we do have some great options for reopening. We, however, are looking at the Delta variant and thinking, because of the governor's requirement that if the council meetings are in person, we have to allow the public to gather. And since we know now that some people, even who are vaccinated, could be carrying the virus, and we wouldn't want to be passing that on to vulnerable populations if they showed up at our meeting, or children, for example. So we're kind of rethinking when we might come back in person, but we can talk about that next week. But I just wanted to let you know that we will have a good briefing next week to see what technology solutions have been brought to bear on this. And it's all, I think, very good news. I think Deb and Nicole and the team have done a great job of coming up with some solutions for us. So stay tuned for that. And that's all I have. Do we have anything to report from administration this week?
Council President Stonecipher.
Oh, I'm sorry.
Bader here.
I forgot. You've been offline. Councilmember Bader, please give us your comments.
Yes, after a long.
Got it to work.
Yeah, indeed. Thank you to our IT department for helping me out. Also want to comment about the Forest Park kind of official opening or ribbon cutting, and that was a great event. And thanks to all our hardworking Parks Department folks for what they've done, just extraordinary. And I think that not only will it make Everett residents happy, but I'm sure young families throughout the region will be visiting Forest Park to make use of the exciting new amenities. Also, condolences to the Anderson family on our former mayor's passing. Thank you to our new police officer, Connor Rose, for choosing to serve in Everett. So grateful for that. And then finally, just wanted to say thank you to Chief Templeman for his recent comments on Facebook and other media about the in the wake of the changes to the laws from Olympia that have now been instituted, and appreciate him making Everett, people of Everett, aware of the new challenges that our police force faces, as well as making residents of Everett know, obviously aware of where those challenges now have come from as well. So certainly hope they don't blame the city council or the mayor for these additional challenges. But again, thanks, Chief, for sharing that information, and I look forward to hopefully a briefing maybe from the chief about that we can ask some questions as well. Thank you. That's all I have.
Thank you. Is there anything to report from administration?
Thank you, Council President Stonecipher. This is Lori Cummings. There are no administrative updates today.
Thank you. And moving on to our city attorney, Mr. Hall, do you have anything for us today?
I have two items. First, we're requesting a 10-minute executive session to discuss a legal matter pursuant to RCW 423110-1H3 with potential council action to follow. Second, I wanted to give you a brief update. Some of you have probably seen media references to a settlement of the Purdue bankruptcy matter. It's not really a settlement, it's the bankruptcy court's potential approval of a final bankruptcy plan that would be binding on all creditors, including the city of Everett. Recall that in the midst of our litigation against the manufacturers, the number of manufacturers and distributors of opioid medications, Purdue Pharma, one of the larger ones, filed for bankruptcy. And that had the effect of removing Purdue from the civil litigation and placing all claims against Purdue in bankruptcy court, where a bankruptcy judge would develop and approve a final plan to make payments to creditors and claimants, typically, of course, at a rate far below what they're actually owed. That's the point of bankruptcy court. The company can't pay off all its debt, so a judge decides how to divvy up what it can pay. A steering committee has been negotiating with Purdue and has agreed to a plan that allegedly about 95% of the 120,000 creditors support. So it's highly likely that next month the court will approve this plan or something very similar to it. Under the plan, the Sacklers would give up control of the company. The new company would have a new name and be run by an independently appointed board. Profits from the sales of OxyContin and the various addiction reversal drugs that they produce would go into creditors' trusts that would fund addiction prevention and treatment programs. The Sacklers, who have not filed for personal bankruptcy, would pay $4.5 billion of their personal funds over 9 years. And in return, they will receive a release that would protect them from potential future lawsuits against them personally. Right now, the law doesn't create personal liability against the Sacklers. The point of the release and the reason they wanted the release is that there have been proposals to change the law that may make them liable in the future. And so they were willing to put up this $4.5 billion of their own money in order to get that release and gain that future protection. Under the plan, this, let me see, take a look at my notes here. How much money will we get? That's the question you're all wondering. There's a real complicated formula for how the funds would be distributed, and that's still being worked out. It's likely that the money will go to the states, who will distribute it to counties and cities, and the amount that will eventually trickle down to Everett will probably be pretty modest. I don't know what that amount is right now, but when we get details of the formula that's finally approved, and I have a better sense what that number looks like, I'll obviously give you an update. In the meantime, the main litigation involving all of the other manufacturers and distributors is continuing on, but there's no news to report on that. And I do want to add one big picture comment, and that is that although we're not going to see a large financial return, which we always suspected, the city and the council and the mayor really should be proud of the role that we've played in this litigation. Everett was the first city to take what at that time was a pretty bold and innovative action to file a lawsuit against Purdue. We then prevailed in district court, defeating a motion by Purdue to dismiss our case. And it's easy to forget what a big deal that was. And it really was. It was groundbreaking. It was the lawsuit that opened the floodgates that resulted in thousands of other lawsuits being filed, and eventually paved the way for this settlement that's going to result in billions of dollars to fight the opioid epidemic. So although Everett probably will never get the credit it deserves, we really should be proud of our role in changing the entire legal landscape around the opioid epidemic. So that's all I have. Thank you.
Very good. Thank you.
President Stone Cipher, I just want to
Yes.
speak up and just do a big thank you to our legal department. You're absolutely right, David. Thank you for reminding us of that historic move. And clearly, we were only able to do that because of the outstanding legal team that we have with you and Tim and Ramsey and so many others throughout the department. So thank you so much and appreciate your leadership.
Thank you, Mayor.
President
Thank
Stone
you.
Cipher?
Yes.
I just want to add my thanks to our legal team. And frankly, I want to add my thanks to you, Councilmember Stone Cipher, and Council President Stone Cipher, because you brought forward the information that was disclosed in the LA Times investigation. And I know that you and I and Councilmember Toohey got to go to federal court, and they wanted to make sure that the court understood that Everett had some skin in the game here and cared. But it wouldn't have happened, I don't think, had you not brought that forward. So I want to thank you as well as our team. Thank you.
Thank you, Councilmember Roberts. I appreciate that, but I appreciate the city and the legal team for having acted on that information. I think it was a little bit of a stretch at the time, but given the information that was revealed in the LA Times articles, investigative reporting that was really top notch, it definitely was the right thing for us to do. And so I am proud of that. It's a good moment for us. So if we do get any money, though, I would love for us to see us use that for treatment centers and treatment programs, because that is an area that we're really lacking in our community. And it would be nice if we had some seed money there to kick off even just some new programs for people who are suffering abuse disorder in our community. We'll move on now. Deb Williams, have we received any comments from the community for public comment today?
Good afternoon, President Stone Cipher. We have no one waiting to speak, and we have no written no written comment for today. Thank you.
Thank you. We will move on to our consent agenda. Do I hear a motion to approve the 8 consent items?
Roberts moves approval of the 8 consent agenda items.
Councilmember Toohey seconds that motion.
And we have a motion and a second. Clerk, will you please take the roll?
Councilmember Bader.
Yes.
Councilmember Moore.
Yes.
Councilmember Murphy.
Yes.
Councilmember Toohey.
Yes.
Councilmember Vogely.
Yes.
Councilmember Roberts.
Yes.
President Stone Cipher.
Yes. And now we have one item that is on for proposed action. It's a first reading, so I will read it. Item 9, it's Council Bill 2107-23. It's first reading. Adopt an ordinance relating to stormwater controls in the combined sewer area, amending ordinance number 3731-20. The third and final reading of this will be on August 11th of this year. And I'm going to ask if any council member has a question on this item for proposed action, please unmute yourself now and make yourself known. Hearing none, we will move on to our action items. Item 10, concur with the mayor's reappointment of the hearing examiner and authorize the mayor to sign amendment number 1 to the personal services contract with Sharon Rice as the land use and code enforcement hearing examiner for a term of 4 years, beginning August 1st, 2021. Do I hear a motion?
Moore moves yes.
Councilmember Bader will second.
Great. We will go down the line to see if anyone has any questions, starting with Councilmember Bader.
No questions or comments. Thank you.
Councilmember Moore.
Yeah, I didn't mean to combine a vote and the motion, but I have no further questions.
Councilmember Murphy.
No questions. Thank you.
Councilmember Toohey.
I have no questions. Thank you.
Councilmember Vogely.
No questions. Thanks.
Councilmember Roberts.
No questions. Thank you.
And I have no questions. Clerk, will you please take the roll?
Councilmember Bader.
Yes.
Councilmember Moore.
Yes.
Councilmember Murphy.
Yes.
Councilmember Toohey.
Yes.
Councilmember Vogely,
Yes, there's a typo. We can talk about it later.
Councilmember Roberts,
Yes.
President Stonecipher.
Yes. We'll move on to our council briefing agenda. These items come before the city council serving as a council committee of the whole and are likely to be scheduled at a future meeting. Item 11 is a public-private partnership to provide senior center management and programming to Volunteers of America of Western Washington. I believe we have Teresa or Bob Leonard here to present today.
Yeah. Hello.
Hi,
Good
Bob.
Yeah, hi. Good afternoon. Bob Leonard, Director, Parks and Facilities. I want to take a few minutes to brief you on the agreement with Volunteers of America to provide senior center management and programming at the Carl Gibson Senior Center. Also here today to answer any questions is Steve Corsi, President and CEO for Volunteers of America, Western Washington, Assistant Parks Director, Kimberly Shelton, and Procurement Manager, Teresa Bauchio-Teschlag. I want to acknowledge all of the great work by procurement and by legal, specifically Deputy City Attorney Tim Benedict, in helping Kimberly, the Parks team, and I to finalize an agreement that is a win-win-win for seniors, the city, and Volunteers of America. Volunteers of America, or VOA, is a nonprofit human services organization which produces high-quality programming and has 123 years of experience in managing human services. Through the general request for proposals process, VOA responded as interested in managing the Carl Gibson Senior Center on the city's behalf. It has been a pleasure working with VOA on this partnership agreement, and we have the utmost confidence in their ability to provide senior services on behalf of the city. The Parks and Facilities Department has negotiated a 14-year agreement with Volunteers of America. This management agreement is very similar to the management agreement we have with the Village Theater for managing the Everett Performing Arts Center. The payment structure is designed to set VOA up for success, giving them more financial support in the early years and less financial support as they are able to increase fundraising, grants, and membership efforts over time. The city will pay VOA just over $1.8 million over the next 7 years. There are no payments after those first 7 years. The contract is good through 2035. However, the contract can be terminated by either party for convenience with 6 months' notice. The contract has been reviewed and approved by the city's legal department. In 2016, which is our best year of operations in recent history at the Carl Gibson Senior Center, the lowest subsidy the city paid towards senior center operations was just under $500,000. This does not include the custodial maintenance labor cost, facility supplies, or utilities. If we included those expenses, the projected city savings as a result of this partnership would be even higher. Calculated just over the 14-year life of this contract, this would save the city nearly $5 million, while still providing the same valuable services to our senior community. This agreement does have provisions for possibly opening the senior center in September of this year. Due to the pandemic and the transition, this will largely be virtual services for the remainder of 2021. Starting in 2022, hours of operation will be Monday through Friday from 8:30 to 5:30 and Saturday access from 8:30 to 4:30. VOA does hope to eventually expand programming to other underserved communities. There will be similar programming to what was offered before the pandemic. Annually, VOA will submit a service plan that will be approved by the Parks Director. The proposed plan will include the proposed budget, specifics of the services to be provided by VOA for the upcoming year, and will contain specifics regarding scheduling and coordination of city and VOA events. This review process will also include a review of VOA's performance of this agreement during the previous year. Once the Parks Director approves VOA's proposed plan, it will govern the services for the upcoming fiscal year. The VOA will retain all revenues related to membership, donations, parking, rental fees, and programming fees. As noted, the city will review and approve the proposed budget on an annual basis, which includes proposed revenues from the sources previously mentioned. The VOA will pay for all expenses related to the operations of the building, including janitorial, utilities, maintenance of kitchen, fitness, and other small equipment, as well as general operation costs like staffing and supplies. As the building will remain a city asset, the city will pay for building maintenance related to the shell of the building, like HVAC, roofing, carpet, major painting, doors and window repair, electrical, and elevator maintenance. Any capital investments made by the city are the property of the city. The city will have access to the center in the evenings and Sundays for other recreational programming, special events, emergency management, stuff like that. Approval of this agreement is scheduled for next week's council meeting on August 4th. And this concludes my briefing.
Thank you. We'll go down the roll to see what questions or comments our council members have, starting with Councilmember Bader.
Thanks, Council President Stonecipher. Appreciate you bringing this to us, Bob. I know a lot of hard work went into this. Just a little worried that it's only virtual reopening until the end of the year, because I know at least my senses are a fair number of seniors that are chomping at the bit to be able to gather at the senior center in person. So just if there's anything that can be done to move that up more quickly, I think that would be helpful. But again, thanks for all the hard work on this, and thankful to VOA for bringing this to us.
Yeah, and I'll just add on that point, thank you for bringing it up. I think we're all in alignment on that. The VOA with council and with the city, we would like to see it opened up as soon as possible. Of course, we have fears about what the pandemic is doing still with this vulnerable population, but we will explore avenues to try to get the senior center up and going as fast as we can.
Thank you. We'll move on to Councilmember Moore.
No, my thanks to you, Bob, and the entire staff for this work. I think the brevity of the briefing was appropriate, but it understates the complexity of the work that was done through this partnership. And so thank you to the VOA. Always believed in this as a win-win, and this is a celebration. So thank you to VOA staff for your interest, and your reputation precedes you. So we're excited.
Thank you. Councilmember Murphy.
Yes, thanks, President Stonecipher. Bob, thank you for the briefing. I do have a few questions on this, having only received this in the last few days. Apologize I didn't get a chance to get with you earlier on some of this, but having to do with the 14-year agreement, it's a little bit concerning, I guess, that the fees are all front-loaded for the first 7 years, because given the termination provisions of 6 months, I know we're all going into this with good faith, but what I guess concerns me is that, very heavy front-loaded subsidies in the first few years, and if things don't pan out from a fundraising perspective, I guess for the VOA after the 6th or 7th year when this funding subsidy occurs or comes to an end by the city, what's to stop VOA from just giving us 6 months notice and ending it after we've been paying them for 7 years?
Technically, as you stated, we have been operating in good faith, and we do believe that the VOA has been a good partner and will fulfill the obligations of the agreement. But there is a clause in where anybody can get out of the contract for convenience within 6 months. However, having said that, one of the things we did ensure under this framework for payments is that no single year exceeds what we, the city, would have paid for senior center services that year anyway. So each year we go along, the financial burden to the city gets lessened, and in no single year are we exceeding what we would have paid anyway.
Right. So I guess that by extension, then what you're basically saying is that if after the 6th or 7th year the VOA did decide to terminate the arrangement, the city could always go back to a model similar to what we had before, which was that the city would potentially operate or look at another nonprofit, I suppose, at that point.
Correct. And we would have, and over those 7 years, the city would have saved money compared to operating it itself.
Right. Okay. And then just two other questions. I know that, or at least I believe that the seniors up until the time that the senior center was closed, that the seniors paid some sort of an annual fee to be members at the senior center. And I don't recall what that was, but I do seem to recall it was fairly nominal. I want to say $15 or $20 a year. Is there anything in here that protects our seniors from the VOA sort of spiking up the annual fees? And you listed a number of other fees that they're able to charge the seniors as well, including parking and other sorts of things. Is there anything to sort of put some checks and balances in for our senior citizens?
Yeah,
so
yes.
they don't get some big increase in their fees?
Yes, there is. In section 4 under finances, it says that the VOA may adjust rental, membership, parking, sticker, and program fee rates annually with the approval of the city, which will not be unreasonably withheld. So as long as their request is reasonable, we wouldn't deny it. But if it was unreasonable, then we could deny their request to increase it unreasonably.
Okay, and so if there was, because I could also see that, you know, over the course of 7 years, there could be some cost of living sorts of inflation adjustments and that sort of thing. Okay, and then the last thing was, as you mentioned in your briefing, Bob, that there is a service program annually provided by VOA that gets reviewed by the city staff. Do we have such a program already hammered out in place for this first year of operations? And if so, is that something that could be provided to us? And maybe it was and I didn't see it, but did we get the service program?
No, I believe the service plan is currently the existing contract in the appendices, which go over the programming that they're going to be providing.
Okay, so we've got that as part of this agreement we were provided?
I believe so.
Okay. All right, well, I will go back through and look at that a little more closely before we come back for the vote, but that's all I have for now. Thanks, Bob.
Thank you.
Exhibit A has the program list for 2021.
Thank you.
Good,
Thank you
thanks.
for that. Next, Councilmember Toohey.
Yeah, thank you. And Councilmember Murphy, I had that same question on the compensation and didn't know if there was any repayment of any clause or anything for, you know, if VOA decides to get out of the agreement early, since we're paying for 15 years. And anyway, that was just a question. I don't know, Bob, they can look into that. And then my other question was, in the past, there was a board of directors for the senior center, and you know, with city staff and seniors, and I know I was a liaison for that as a council member, and I don't know if the VOA is going to do anything like that or have a committee that just with including the city and other seniors that kind of overlooks the whole process.
I think that's something that we still have to explore. I do want to point out, though, in our brief discussions around this, that we do believe that our Board of Park Commissioners also has a governing role in this area, as the Senior Center falls under the Parks Department, and we do have the Board of Park Commissioners. So I do think there is some citizen board oversight in these areas. Whether or not we'll still have the Senior Center Board in the same capacity, I think is still a little bit yet to be determined.
Okay, all right, thank you. That was it.
Thank you.
Look forward to having it open.
Yes, absolutely.
For sure. Councilmember Vogely.
Thank you. Good to see you all. And I just want to give a shout out to staff, woohoo, especially because you know this stuff like the back of your hand and can just say, yep, that's where that information is. So thank you, Teresa. Going virtual. Okay, great. Lunches, I imagine, will still be available. So I just wanted to put that out there, that I know during especially the heat, people were very concerned that our seniors were being left to wither. And so lunches will be available still. And And then I wonder too if it can be opened if we have another heat wave or a smoke, from forest fires coming our way, if there will be the ability for a cooling station or a smoke-free area for people that need that. Let's see, evenings and Sundays. That's pretty awesome that the city will still have use of the facility, if I heard you correctly, evenings and Sundays for various stuff. I liked that verbiage there, Bob. So that'll be exciting. And then I know that the parking lot, I remember some excitement about that because they opened up parking and signage for evening events and whatnot. Will the city still get the paid parking dues for that, or does that go to the VOA, or what?
Parking goes to the VOA. And I do want to your other point, there is a provision in the contract that still allows the VOA to provide access to the public as a cooling or warming location during normal business hours on an as-needed basis in the event of extreme temperatures or emergencies.
Cool. Okay, wonderful. Thank you. And then Councilmember Toohey kind of brought up the board of directors, which I was also interested in and wondering if council would be a liaison, but you already answered that question. And I just wanted to mention that when Councilmember Murphy was speaking about fundraising, and if a few of us were, if the VOA decides to just quit, I wanted to bring up that I bet they're going to do fantastic at fundraising because a whole lot of people have made a whole lot of money this past year. A whole lot of people haven't, but the ones that have made a whole lot of money are typically giving away to fundraisers, especially to very important, got lots of stuff going on in my front yard, very important things. So I think that fundraising will be spectacular and it won't be a problem. That's all I have. Thank you so much. Thank you.
Thank you. Councilmember Roberts.
Thanks, President Stonecipher, and Bob. Thanks to you and the team for bringing this forward. I think everybody on this council has been concerned about trying to get this open. So just hats off to you. I think a number of the questions I had, and in particular the sort of the term and so on, have been answered. So I have a couple of quick questions though. One, as I looked at the Exhibit A, it has the year 2021 and it says if possible, and I'm assuming if possible means if we can open and if we have other restrictions and so on and so forth. And I guess I'm implying in my question we wouldn't be moving forward to open a center unless it was safe, and in terms of the CDC and COVID issues. And you're shaking your head affirmatively, so that's good. But the other question I had was, if we can't open it, does that change the terms of the contract? And then related to that, in the indemnification, are there any risks associated with this if we were to open and someone were to contract COVID and so on? Have we addressed that in either this agreement or in some other understanding of that liability or potential liability?
First off, I don't believe that it would change the terms of the contract. We had these last 4 months of this year were added on as an additional expense. We will be paying the VOA. Let me find my note here on that one. Basically $28,750 per month this year to open it up this year. So really wouldn't change the overall term of the contract. As for the question about COVID, no, it's not specifically addressed in the agreement. I believe it would be treated just like if somebody were to contract COVID at any one of the other city's facilities.
Okay, thanks.
Thank you. And most of my questions have been answered. First of all, I want to say that I appreciate administration, Bob, you and your team and everyone who has worked really hard to figure out a way to maintain and operate our senior center and get it reopened. And very excited about the partnership with the VOA. But when we talk about saving money, then I kind of start thinking about where that's coming from and how that is working. So I noticed in the staffing section of the agreement, we're requiring 3 full-time equivalent employees. And I'm wondering, how does that compare to the number of FTEs that we were operating the senior center under when the city was operating it?
We had 3 full-time employees when we were operating it. And actually, I think VOA's plan is to probably have more. We just limited it to if we were requiring that they basically have at least 3. But when our negotiations and conversations with the VOA, I believe that they're optimistic that it's going to be so successful that they will probably need more staffing there.
Okay, and then when we talk about the lunch program, that I know that was a federally funded program, VOA, will they be as eligible for those funding sources as the city was? Is that a federal program that they'll be eligible for?
Kimberly?
I can answer those questions. And just to clarify, we did have 4 full-time staff members when it was city run. And then the meal program is provided by Homage, and Homage applies for the federal funding that supports that. It's never been run through the city that way.
Okay, and so that program will continue under Homage?
That's really up to the VOA to determine which meal service they want to use.
Okay, but there's
experience in these areas, and they might have a other provider that may do comparable or better services, or they might expand it beyond lunch. So, I mean, we would really leave it up to the VOA to discuss that with us.
Great, thank you. So the savings then, I mean, I'm just trying to make sure I understand how the savings are being realized in this. Is this because the overhead of the city is such a heavy financial burden on the center that by lifting that overhead, the VOA's overhead is less than that? Or, the concern I have is that the staff members there will be shortchanged in terms of salaries. I mean, how are salaries to be established for these positions? Benefits and all that stuff.
I think it might be best to let the VOA respond to that.
Thank you.
Steve, do you want to take that?
Sure. Thank you, Madam President. I was going to say, until this point, I was going to say that was the easiest presentation I've ever given. So in answer to your question about salaries, the way I would respond to that is that our HR department is already looking at and has already developed job descriptions and would look at comparable positions in the area, in the Puget Sound region, and find what is that range that we need to be in to be competitive and to be fair. Obviously, we don't want to have retention or recruitment issues. And if we're not competitive, we're going to have those. So if that answers your question.
Yeah, that's helpful. And I
that when we talked about it with with VOA, they have a great, huge network and ability to generate and sponsorships and donations, and they've been doing that. This really right up their alley to be able to generate income in those methods much better than the city could even do it.
So, Madam President, did I misunderstand the question? I thought it was about wages. Was it about fundraising? Because I can address that if you would like.
No, I'm just kind of trying to figure out if we're talking about saving $500,000 a year on the operation of a center, that's coming from somewhere. And I'm trying to understand from a big picture perspective where that savings is being realized and how that comes about.
So Bob, that might be better for you to explain.
Yeah.
I would explain that would be, so the first year is going to be the heaviest subsidy from the city of Everett, and that's to give us a chance to get on our feet and begin the fundraising process and develop those many relationships we already have in place, but to develop other relationships that we don't even know yet. The first year and even the second year and then the third year. And the city's investment in the center is going to decline as our fundraising capacity raises. By the 5th, 6th, 7th year, we'll be raising enough funds either through fundraising or services offered, I don't know, medical services or who knows what. We'll figure out ways to finance all those years going forward. So with each subsequent year, the city is going to save in year one, not a lot of money. In fact, maybe not even any money, I don't recall. In year two, the city's going to save a little bit over what it would have spent the previous year. Year three, even more. And by year 5 or 6, whatever it was, there will be no investment. So the city is literally saving every year's investment that it was putting in prior to VOA entering an agreement after that, after that point.
Okay.
So, does that make sense?
So well, yeah, I mean, it's kind of, yes, I mean, it does make sense, but my question's a little probably more esoteric than that. So essentially, the expense structure of the facility management and operation is not changing very much. It's really this revenue piece that you are able to bring to bear that we have not been capitalizing on the city side. Is that how I should understand this from a real big picture perspective?
That's the way I would suggest understanding it. I'm just guessing that, you know, we have a lot of major gift donors that I'm assuming that the city doesn't.
Got it.
Yeah, President Stonecipher, this is Mayor Franklin. I think a nonprofit's ability to raise dollars from the private sector for the work they do is just outstanding, whereas a city, people typically don't want to donate to the city to run services. There are very few cities that run senior centers because of this, and so nonprofits tend to be better equipped to run them because they can generate the private support to subsidize the really important programming.
Yeah, that makes sense to me. And then my last comment really is just that I was really happy to see that you're thinking about bringing in individuals and some young people too into the center and doing some programming with developmentally disabled individuals that might benefit from being engaged in the programming that you are offering there. I think that provides some great opportunities, I think, to really engage some members of our community that we don't often have a lot of programming for. So I'm glad to see that. Hopefully that will pan out. Those are all the questions I have. And
Madam President, may I make a comment?
Yes, please.
I just want to thank the City of Everett staff, Bob and Kimberly and Teresa. They really have put a ton of work into this. Our team has as well, but the city team has just gone above and beyond and putting the work into it. And actually, to their credit, when we pushed back on a number of items, they pushed back a little harder. So you should be proud of the city team. They did a great job.
That's great. Thank you. I guess from my last comment on the city side was, as I recall, and we're going to have a budget briefing here, maybe Susie can respond during that time. But as I recall, we did not have the senior center in the budget this year. So is this funding that we would be, or did we have something in the budget? How does this impact our city budget for senior center?
I believe we had some, oh, I'm sorry.
Sorry, Bob. We had some funding in the budget for the senior center in the hopes that it possibly could open this year. But we had not envisioned being able to conclude this work with VOA until towards fall anyway. So.
Okay, so we're okay from a budget standpoint for this year?
Yes.
Very good. Okay, thank you. And this will come back to us for action next week. Is that as I understand?
That is correct.
All right. We will see you then.
Thank you.
Thank you. We'll now move on to item 12, the City of Everett Health Plan briefing. I think we have Marcy Hammer here. Maybe
Yes.
Candy.
Good afternoon.
Hi,
I'm
Marcy.
going to go ahead and share my screen here. So hopefully this all works. Everybody see that in front of you? Perfect. So thank you all for having me today. Marcy Hammer from Human Resources. I oversee workers' compensation and benefits and retirement here at the city. So today's briefing is just to give you an update of kind of where we have been in the last year and a half, especially with COVID, with the opening of our near-site clinic and introducing a new consumer-driven health plan with HMA for our employees. So our goal with Everett Health over the last 2 years was to develop and promote employee engagement and a comprehensive health and wellness program while maintaining the budget. So today's briefing again is just to give a brief update on how the self-funded health plans are doing, as well as an update from the Vera Clinic's practice manager, Nora Ross. So she'll take over about midway. So the slide you see in front of you illustrates just plan migration from our traditional HMA plan, so the original PPO plan that we had, and plan migration over to the new consumer-driven health plan that we introduced in 2020. So in the bright blue, that's the total plan enrollment for the traditional PPO plan. In January of 2020, we had about 623 participants. And with the consumer-driven health plan, which is the darker kind of green color, we had about 242. In the fall of 2020, we did still a pretty robust open enrollment, even though we were in times of COVID. And with our PPO plan, we were able to have some more plan migration over to the consumer-driven health plan, which a total of 304 participants in 2021 in January, and 535 remaining on that traditional PPO plan. And then as of May, we've had added some more staff and qualifying events and things like that. So as of May, we upticked just a little bit in enrollment for that consumer-driven health plan, which is about 315 participants, and 519 still remaining in our traditional PPO plan. There is a cost share for that consumer-driven health plan that we worked hard to work with our unions to come to an agreement on, and it ranges from a 5% to 7.5% premium share. So come fall this year, we plan on doing more outreach, more engagement, and education sessions on the benefits of migrating to the consumer-driven health plan, but we do expect some will still remain in the traditional PPO plan. The next two slides that I'm going to talk about is just basically the overall budget and experience, both in 2020 and then year to date as of May 2021 this year. So what you see in front of you is the 2020 experience. As mentioned, we have the enrollment listed in the far left column. That 1,045 is actually just our total benefit eligible employee population. So we're purely focused on our self-funded plans. So both the traditional PPO as well as that new consumer-driven health plan. Also included is the Vera Clinic costs. So I'll just walk through. Fixed costs include things like our per member per month fee with Vera Whole Health. Also the plan administration fees that are assessed by HMA, and also our excess carrier or stop loss carrier for health benefits. The next column describes the net claim costs, so what we're actually paying out in claims, and then the Vera Clinic operation costs. So those are the pass-through costs, things like salary, lease cost, all of those things are built into this column here. and then the total cost of both. This does not include any stop loss claim violations. So those are those really high dollar claims. So those are excluded from the total plan cost once the stop loss carrier starts paying. And then the budget for 2020, and then how we ran. So we ran almost as expected, but as you can see, with our consumer-driven health plan, we ran about 23% under of what was expected. Moving on to 2021 and our year-to-date experience through May. This follows the same pattern as far as each column. But as you can see, our PPO plan is running much higher. There's a couple reasons for this. One being plan migration. So those that are typically low utilizers of health insurance services, they're most likely going to actually stay on the PPO plan. It's what's familiar to them. There's a cap on their out-of-pocket exposure. So this was expected. Also, with COVID, we saw, people postponing their services or not being able to schedule procedures. So now in 2021, that is now ramping up. So again, it is running a little bit higher, and I'm sure Susie will address what the expectation is for 2022. As you can see, the consumer-driven health plan is still running really great, even though we have more enrollment. It's still running well under budget. And then for our Vera Clinic cost, we are running a little bit higher. And I know that that can maybe cause some alarm, like, wait, what's going on? This is actually a positive thing. So a couple of reasons for this. One reason is that we are running about 6% of our generic prescriptions through the Vera Clinic. And what that means is it's reducing the cost on our RX plan or our prescription drug plan and raising the cost on the Vera Clinic. However, we're getting those prescription drugs at a pass-through rate, so there is no markup. So that is a reason that it is running a little bit higher, but again, it's a positive reason to be running a little bit higher than the budget. And then overall, we're about 4% under budget and what was expected. So now I'd like to introduce Nora Ross, and she is our practice manager over at the Vera Clinic. So Nora, if you want to come on, and I'll guide you through your slides. And hopefully, are you there, Nora?
Nora, you are muted.
Well, it looks like it didn't want to let me talk. Can you hear me now?
Yep, we can hear you now.
Perfect. Well, thank you so much for having me here today. I really appreciate it. As Marcy mentioned, my name is Nora Ross, and I'm the practice manager at the Central Everett Vera location. And in early 2020, we've partnered up, Vera Whole Health have partnered up with the city to offer free primary care services to City of Everett HMA employees, spouses, and dependents. So today I would like to share a little bit about some of the care center highlights since we've opened in January of 2020, including appointment and patient satisfaction data. As we know, 2020 was a really challenging year, especially for us here, as well as we faced a pandemic 6 weeks after our grand opening. So it was an interesting year. But yeah, I would like to also share a little bit more about how we responded to the COVID-19 outbreak and how we supported your community. And last, I will also go over our financial performance. Next slide. Perfect. Thanks, Marcy. So some of the highlights from 2020. in our first year that we have the care center, we engaged with 40% of all employees on the HMA plan. Our goal was to engage 60%, but with COVID and having to shut certain things down a little bit, we ended with 40% of engagement. So some sort of encounter with our clinic, with our Vera clinic. Overall, we provided 2,523 appointments last year and had a patient satisfaction score 4.74 out of 5, which is a really great score. I'm really delighted to share some of our 2021 numbers. I have data through the end of June, and you do see that in just half a year, we have already engaged 40% of all HMA employees. That's the number that we achieved after 12 months or 11 months last year after we've opened. So I'm really positive and confident that we can get to our targeted 60% of employee engagement. And so far, we've already provided 2,123 appointments, which is almost the same number as we did in just 1 year last year, and increased our patient satisfaction score just a tad to 4.75 out of 5. Some additional highlights for our clinic are our outreach events. So we hosted an on-site here at the clinic flu clinic last fall in September and October. I know things had to look a little bit different than you were used to last year. So we had really great participation and administered almost 400 flu shots to employees and family members. This year, in the spring, we also hosted an on-site COVID-19 vaccine clinic, and we've provided 488 COVID shots, again, to your employees and family members. So that was a really great public health effort to get a lot of people vaccinated. And throughout the year, we're constantly offering, currently still virtually, coach workshops to make sure that we're staying in tune with your community, help them support through these challenging times. So we have different topics every so often, but those have been very well attended as well. When it comes to COVID-19, we obviously had to respond as a healthcare provider and adapt. We have started doing testing right away. When it comes to testing, there's different kinds. You may know all the different kinds, but I wanted to go over some of the difference as well. We have done so far 112 PCR tests, which detect viral RNA, which is sort of like the most accurate test when you can think about it, but oftentimes you have to wait 1 or more days for your results. But we also have rapid testing, antigen testing, and saliva testing available depending on the need. So really great options for patients to have. We've also implemented robust safety measures in the care center, which includes enhanced cleaning procedures, obviously wearing masks, both staff and patients, and allow for social distancing to keep everybody safe and keep the well separated from the sick. We've also implemented a really strong clinical follow-up strategy, which included making sure that sick patients were followed, right? Whether they had COVID, whether they were COVID positive or had other conditions, making sure we follow through, do outreach, making sure patients take their medications, making sure to stay connected in the pandemic. Since we've opened in 2020, we've also been able to implement some new services, which was very exciting. Just last October, we introduced performing CDL exams here, which have been very popular. So since then, since October, we've done 52 exams, which is really great. We had also implemented a voluntary separation program, which is now running out at the end of July. but folks that voluntarily separated from the city last year were granted access to Vera Whole Health for an additional year, which seemed to be received very positively, and folks were really grateful to have access. And we had a pivot, right? I mean, in a pandemic where you can't necessarily see everybody in person, we implemented a robust virtual telehealth platform just to add to options for patients to see us either in person, do visits over the phone, or meet with their provider or coach virtually. And here I'd like to share some of our patient testimonials, just so that you get a sense of like what people think about us. My visit to the Vera Clinic was the most positive experience I've had with any doctor's visit. The staff were friendly, explained everything extremely well, and I felt they were genuinely there to help me. Nothing is normal right now, but I felt like they were on top of all the precautions. They did what I went in there for, and I'm confident in their ability. I like that they're proactive. Thanks for the great service. It's amazing how fluid the clinic is during this time. I've had in-person visits, over the phone visits, and computer visits. All have been pleasant. Great clinic, great staff. Thank you. Fast, efficient, professional, and friendly. Highly recommended this clinic. We needed this years ago. So I always love seeing these types of comments, how grateful people are that you put this in place for them. So thank you for that. Going over a little bit more of our patient satisfaction. So I do want to talk a little bit about the Net Promoter Score. Some of you may not know what this means, but the Net Promoter Score, also NPS, is a widely used market research metric that typically takes the form of a single survey question to rate the likelihood that they would recommend either a company, a product, or a service to a friend or a colleague. So in our particular case at Vera, we asked the question, I would recommend Vera to a coworker. So it's a very simple question that folks can rate, and that's how we get to our score. And we had a really, really wonderful score of 82.11. The NPS score, the Net Promoter Score, can be anywhere between -100 and +100, and really anything above 70 is exceptional. So it's a really great statement right there, what people think about the Vera Clinic. Now we're diving a little bit more into the cost analysis, because ultimately our goal is to save money, right? We want to make sure that this makes sense fiscally as well, on top of having patients really great experience. So I'm going to go over this slide a little bit to explain it. Here we're looking at the historical trend method to calculate an ROI, a return of investment. And so we look at the entire population that is eligible. So those are HMA members. That includes both plans, right? The PPO plan and the CDHP plan. And we're looking at anybody 3 and over who is on the plan. And we're looking what the spend was of their claims 2 years before the Vera Clinic came into play in early 2020. So we're looking at claims data, both medical claims data and prescription claims data from 2018 and 2019. So that is represented in the blue line. And just to kind of give you an idea, in 2018, per member per month, that cost was roughly $420. In 2019, it was even a little bit more at $435. So we took that data, and based on that data, we predicted a trend. So you can see the trend represented in the orange, in the dotted orange line. And then what we're looking at is what were the actual claims cost for your HMA members after Vera came into play, so in 2020. You do see a significant dip. It's represented in the orange line. We all know COVID probably had something to do with it, right? Specialty offices closed down, and surgeries, procedures were on hold, so less claims cost associated. But even overall, and even after things went back to normal, we do see a little bit of a spike at the end of the year, but that's typical as well. People have met their deductibles. They want to take care of things before the end of the year. Overall, we do see a significant reduction in claims cost after Vera came into play. So it's about $50 per member per month that we've saved in 2020. And just, I mean, Marcy, if you want to go back one more, just to kind of add to it, is we're also taking out any claims, any outliers in this analysis. Anybody that had a claim above $150,000. Yeah, so that's just what I wanted to add as well. Awesome. And here I'd really like to highlight some of the great trends that we're seeing related to preventative care. So we have seen, which is a little bit of an anomaly, we have seen a 25% increase of preventative visits in 2020 compared to 2019. Remember, COVID hit relatively early in 2020. Things were on hold, but we actually saw an increase in preventative visits. So the blue line here represents preventative visits done at an outside of Vera provider. So anywhere you go with your insurance card and it's processed through HMA. The green line is any preventative visit done at a Vera clinic. So you do see it's starting to dip mid-year in 2020, where employees, HMA employees and spouses and dependents start going to other places a little bit less for the preventative care and come to Vera more. And I think it's, again, it's remarkable to see that you actually had more preventative visits in 2020 despite a COVID year. And we continue to see the same trend in 2021. We're just seeing even an increase overall. You see that the green gets larger and larger and the blue, is somewhat stable, but overall, we're really focused on preventative care. And it's great to see this on paper as well, that this is actually happening. And here in this slide, very similar, but in this slide, we're just looking at employees and spouses that are on the HMA plan, both the PPO and CDHP. So we're seeing even a larger trend there. And for employees and spouses, it was an increase in preventative visits of 73% in 2020 compared to 2019. So that's significant. That's exactly why we're here. We want to focus on preventative care, keep you healthy, and support you that way. And this is our prescription slide right here. Marcy had already alluded to it a little bit. We're running a little bit higher on the cost of prescriptions in our budget, but again, it's actually a good thing. Last year in 2020, we ran about 4% of all prescriptions, all of HMA plan members' prescriptions through Vera. So that is a cost that was absorbed by Vera. And to Marcy's point, those costs are just being passed through. There's no markup. And in 2021, we're already seeing an increase. So currently we're running 6% of all the prescriptions through Vera. And not only is it a cost saving, but it's also, it's added convenience, because if you're already at the clinic, you can just walk out with your prescription. You don't have to go to the pharmacy and wait, and it's a one-stop shop. So really great to see that.
So at this time, that concludes the briefing. So Nora and I are available for questions.
Great, let's go down the roll and see what questions we have, starting with Councilmember Bader.
Thanks, Council President Stonecipher. Very interesting information. Are interesting about the migration numbers over, and I, at least from what I know from my day job, it doesn't seem too unsimilar, but it still perplexes me that more haven't migrated. Is there any information from the rest of the world about, is this a typical number in terms of percentage of employee migration? Are there any best practices out there to encourage more migration?
So I think it's as far as what to be expected in the first couple of years of introducing a new health plan with a higher deductible. I think just we still get some mixed messaging, no matter how many times I go out in the field. And I will say that 2020 was a little bit different as far as the ability to do the education sessions and everything like that. I think it's also a comfort level with individuals with healthcare. It's a very personal choice, and I think the cost share differences did push some individuals to migrate over. But my hope is every year that we're increasing between 15 to 25%. Slowly, eventually, we'll teeter to more CDH participants and less PPO participants, less PPO participants.
Great, thanks. And the only other question I have, and Deb Williams might know this already, I haven't been in the office since Saturday, so if we haven't gotten the PowerPoint sent to us, can we get that? Because it was really interesting to look at, and would like to go back and look at it further. Thanks.
Great. Next, we have Councilmember Moore. See, Councilmember Moore, any questions? I will go to Councilmember Murphy.
Thank you, President Stonecipher. Marcy, Nora, thank you very much for the update. Very encouraging to see the utilization trends and the expense savings with the Vera Clinic. The question I had has to do with the Vera Clinic in particular, though. I seem to recall that when we approved the Vera Clinic, I guess it's been a couple of years ago now, that there had been talk at that point of, once we got up and running, that there might be the opportunity to further utilize the Vera Clinic resources and the facility to the extent there was additional capacity above and beyond what the City of Everett employees were using. And I wondered if there's been any update to that. Are we fully utilizing that facility? And if not, is there still an opportunity to help subsidize some of those costs and better utilize that resource and that facility that we put in place?
I'll first let Nora answer, because there's kind of two parts to that. So I'll let Nora take that one and then I'll follow up.
Yeah, absolutely. I mean, it's been just a really interesting year, right? Our first year operating in a pandemic. I would say from a space utilization, there is still room to grow. Absolutely. I think from a resource perspective, I mean, we just added CDL exams, which, we've done 52, they're about an hour each. And we continue to talk about, what other services can we potentially add for employees and family members. So Marcy and I, we were in constant communication around that. So yeah, I would say there's certainly a little bit of room still to grow, and we're constantly looking at opportunities.
And Nora, can you speak to the other entity as well that's been added to the clinic?
Yes, absolutely. That's a great point. So we recently signed a contract with another entity, and because their population is located across the Puget Sound, they've decided to add a halftime provider up at the Everett location to support their population, you know. So that's always an opportunity as well. I mean, those costs, you know, you don't have to pay those, but we have added an additional provider to help with that network utilization.
And then just to follow up, as far as the city partnering with another agency, I think that is still, obviously they have the capacity for us to do it. I think you know, who would have thought we opened this near site clinic that we had been talking about for quite some time, and then a pandemic hits a few weeks later. So I think a lot of agencies, at least from what I've heard, and maybe administration can speak to this, but you know, they kind of wanted to wait and see to see how we did. I think the clinic is doing great considering the circumstances with COVID, but I think the door is always open for that conversation to see if we can share some of the costs with another partner.
Yeah, this is Mayor Franklin. I just want to add, you know, it is so hard. We're looking at this great data and really important information thus far, but we are absolutely still in a pandemic and people are not utilizing services as they typically would. Even, you know, healthcare services, it was incredibly slow going in many ways because people were just staying home for the majority of 2020. And even now, as we've opened back up fully, suddenly the Delta variant is causing everyone to stay home again. So we really have to kind of take it in stride that we opened this at this time and this is where we're at. And I think with where we're at, we're doing extraordinarily well. And as we get out of this pandemic, we can start to explore other ways that we can utilize this asset. But I'm really impressed so far with how our team has been working in the clinic and really how our city team is responding to it. So thanks.
Yeah, I appreciate that, and I agree. I've had the opportunity to utilize the services myself personally, and I think the Vera Clinic is fantastic. And agree we may have to wait a bit, but I think about some of the smaller local municipal type governments. So, for example, you know, the Snohomish Health District with a fairly small employee population, the Port of Everett with a fairly small employee population, and it might be worthwhile for us to at least start having some of those conversations, because obviously we're currently as a city paying the entire cost of the Vera Clinic. I don't know, for example, with this new arrangement that you mentioned, where a half-time provider will be paid for by another agency. I don't know, for example, for all the other costs that go along with it, the facility, the utilities, the overhead, the management, whether the city gets some benefit by having another organization utilize the facility. I assume that's part of it, but would just encourage us to consider moving forward that we look at maybe some smaller partners with smaller employee groups, you know, of 100 or 200 employees that would not, you know, create a significant burden on the facility, and that we look for opportunities to continue to leverage it to again, save the taxpayers' resources. So that's all I have. Thank you.
Thank you. Councilmember Toohey.
Yeah, thank you so much. So great information. Really like how you analyzed a lot of this. And I know I've used the Vera Clinic and very successfully and enjoyed my experience and the shots I got. But, and I'm also curious, I like Councilmember Murphy's question about if we were to add partner with any other groups. And I'd be curious on what even a small business might look like if that was a possibility. So I think there might be some potential there. So that's all I have, but thank you so much for all your efforts in putting this together.
Thank you. Councilmember Vogely.
Amazing stuff. I think good questions have been asked and I don't have any for you. So thank you.
Thank you. Councilmember Roberts.
Much has been said. I don't need to repeat it, but I want to thank you for these presentations. I think that we've all said there needs to just be a COVID asterisk by this data, and we'll all continue to monitor it, but it's going in the right direction. I was impressed, though, and you pointed out that 25% increase in preventative visits and so on. You know, those are great trends, and maybe in particular because of the COVID circumstances, and also that the prescription costs are going down. I mean, the trends are going in the right direction, so it's good news. Look forward to more of it, and thanks for all your good work in bringing these services to us. Thank you.
Thank you. And one of the services that you provide at the Vera Clinic is the health coaching. And I'm just curious, how successful has that been? Are we getting the people who have those chronic diseases that probably need some of that coaching? Are we reaching them? And is there opportunity to increase that? Because it seems to me that that is a way to really bring some people who really need some support and getting back on a healthy track into the fold and making sure that they're getting the support that they need.
Yeah, absolutely. And thanks for bringing that up. I think our coaches are doing such an important job. And one thing that has really personally surprised me is just the engagement of your employees and family members in coaching. There was very little resistance. I feel like as we're bringing people in for their annual physical and really look at them as a whole, we have most of them actually sign up for coaching. So which is really great to see, because I mean, I feel like everybody has something to work on, right? It's just been a very challenging time. And the low resistance has really surprised me, in addition to what we do on site. And I would also say what's been really helpful, patients can decide, right, what they want to do. Do they want to come in person? Do they want to keep things virtual? Do they want to see their coach? Do they want to just be on the phone? So I think having those options are really great as well. And in addition, we're offering typically 2 sort of lunch and learns per month. Currently, they're virtual only. We may look at doing 1 in person and 1 virtually, so that we can also have a particular topic, whether that's stress and resilience, right? Where people can tune in and learn some tips and tricks, maybe during their lunch break, or, you know, so that's really how we would like to stay in tune as well. And Marcy and I, we talk a lot, you know, what we think is beneficial, depending on what's going on in your workforce. What can we infuse to make it better for your employees at the time? So, but I'm really excited about the coaching program going so well. And I keep bringing it up with other clients as well. I'm so impressed by the participation of your group.
I'd love to see some numbers on that. So if you're handing off this, that'd be good for us to know how that is working. I think the fact that it's included sort of as a free service is really, really important. So it just reduces all the barriers that anyone would have to participating in that.
Yeah.
So I agree with what others have said. It seems like the trend lines are looking good. But we do know this was an anomaly year, so I guess over the next year we'll kind of get to see a little bit more about, you know, how it's working for us. Obviously that consumer-directed health plan is the one where we're experiencing the most savings. So, whatever incentives we can provide to get people enrolled in that. I know in the past we gave some additional funds if someone would visit the Vera Clinic, or just, again, providing whatever incentives we can, because with health insurance, switching costs are really high for people because they're worried about, figuring out who their doctor's going to be, how they're going to use their insurance. And so if we can switch them in using some kind of incentive, even if it doesn't provide the same cost savings of the initial switch, over time, that can be a very good economic kind of incentive that we could provide to get them in there. And I know you know that, so hopefully we'll get some more people switching over into that consumer-directed plan this fall. Marcy, just anecdotally, have you, from I can't remember who our broker is who helped us put this together, but have they commented on the relative proportion that we have in the consumer-directed health plan? Are we on par with other organizations at this time? Are we high, low?
I know that the first open enrollment period, and I'd have to follow up with you on the percentages, but we were actually higher than expected for migration, and I can follow up with you on what that percentage was. So 2019 to 2020 enrollment, and then 2020 to 2021, we dipped a little bit on what was expected as far as migration goes. I think a lot of it too, I will say, I think we had maybe less than a dozen go back. So they had gone to the consumer driven health plan and then they went back to the PPO plan. So we had about, again, less than a dozen that went backwards. So I felt like that was a pretty good sign, right? We didn't have everybody kick back. But I'm happy to follow up with you on the percentages on that.
Okay, that would be great. I think that 2021 enrollment, even though we didn't quite meet percentages, that doesn't surprise me. I think there was a lot of uncertainty in people's lives and they didn't want to make too many big changes. So
yeah, and especially just the what if I get COVID?
Your health.
It's something affecting their health. So I completely agree. Mm-hmm.
Yeah, good. Well, hopefully we'll get a good campaign and see some more migration this year.
Yeah.
Great. Well, thank you very much. And thank you for all the
All.
information. We'll look forward to
it.
getting the presentation materials if we didn't already receive them.
Sounds good. Thank you.
Thank you. All right. We come now to the budget development briefing, item 13, and we have Susie Haugen and Ray Nielsen here.
Good afternoon.
Hi, Susie.
Hi. So just give me a moment. And I will share my screen. And that looks good. Okay. Okay, so today I'm going to provide an update on the general government's budget performance through June, and then review items that have been added to the balancing list since the last briefing. As of June 30th, total general government revenues were running $717,000 or 1.1% under budget. The good news is that we have been following an improving trend overall through the first half of the year, and I'll drill down into the performance of major revenue components in the next couple of slides. So property tax shows a positive variance at this point. However, it is mostly due to timing issues with receipts. Property tax has not followed normal historical patterns since the start of the pandemic and was actually responsible for much of the large shortfalls that we experienced earlier in the year. Sales tax has been on a positive trend all year and is now $2.2 million over budget, including audit recoveries. The retail, wholesale, and manufacturing sectors have all demonstrated growing strength and are leading all other sectors in the economic recovery. And within retail, nearly every category is reporting revenue in excess of our original forecast. Internet sales continue to drive retail performance in several sectors. Motor vehicles, which is our largest component of retail, went from producing the largest losses last spring and summer to reporting the largest gains in the last few months, despite the chip shortage that is restricting supply. Automobile sales tax revenue is now $678,000 over budget for the year. B&O tax, on the other hand, has not shown the robust activity we've seen in sales tax, and as of June 30th was $3.3 million under budget. Most of the shortfall is within the aerospace category. It's still possible that the activity could be varying from historical trends, and we could see some improvement as the year progresses. However, it's important to note that Boeing ended the 787 production in Everett earlier than originally announced, so we really don't expect to recover all of the current shortfall. Second quarter taxes, which are due on July 31st, may give us a better understanding of where we can expect to see B&O tax by the end of the year. Utility taxes have been on the decline for several years now, as you know, and it's clear that we have not yet found the floor. At $545,000 below budget through June, we are on track to finish the year at $1 million below the original forecast. The same factors we've been talking about for several years now appear to be still be driving tax revenues, including conservation, temperate weather, consumer choices, and billing structure. All other general government revenues as a group are performing very close to the forecast, with receipts less than 0.5% over budget. All other revenues include other taxes, licenses, franchise fees, construction permits, service charges, grants, fines and forfeits, and miscellaneous revenues. Expenditures through June are $4.3 million, or 6.7% below budget. Under expenditures continue to be primarily due to vacancies. Total general government has averaged 41 vacancies through the first half of the year. On July 1st, the police department had 17 vacant positions. Parks had 6 open positions, but has had 11 positions vacant for most of the year. And the library had 4.9 vacancies, but ran with 8.1 vacancies until mid-April. However, as we begin to think about the potential end-of-year budget variance for 2021, please keep in mind that we are proposing to move at least $1 million from the jail fees budget to the left one pensions, which will lower the total under expenditures to $3.3 million. Additionally, we met with Judge Van Slyke and Chief Templeman regarding the current and future trend in jail activity, and are in the process of finalizing a revised forecast based on that input. We'll bring back additional information at the August briefing, but I anticipate being able to increase the budget proposal from $1 million to potentially as much as $2 million. Moving on to the balancing list, the first slide provides a review of the projected deficits as of December 15th, 2020. Of note here is that the contributions to CIP1 and the Left One pension funds are included in the deficit calculations in each year of the forecast. The next 2 slides contain balancing list changes. The lines highlighted in gray were discussed at the last briefing, so tonight I'll focus on the new entries. Beginning at the top, we have the 2020 budget variance, and as noted at the last briefing, it's our recommendation to use the variance towards balancing the 2022 budget. The reason for this recommendation is to give the community a 1-year reprieve from further service cuts, as well as additional time to seek voter approval for new revenue that would protect service levels in the future. At the last briefing, there was substantial discussion regarding the use of this resource with various opinions expressed. However, no clear majority direction was provided at that time. So use of the budget variance for balancing 22 is still our recommended approach and will remain in the proposed balancing plan at least through the presentation of the mayor's budget message in September. Adopting the budget rests with council, and we will make adjustments according to the council majority's direction prior to preparing the budget ordinance. Although we have not yet completed our work on major revenue and expenditure sources, we have made progress on smaller line items. Starting with the transit payment in lieu of tax, or pilot, we have an $879,000 increase from the prior forecast in 22 and $461,000 in 23. The pilot represents a fee that transit pays the general fund in lieu of a business tax. It's used to support services such as street maintenance, traffic signals, street lights, and so on that the transit agency needs to provide transportation services. The source for the increase is the extraordinary operating grants that transit received through the CARES program. You can see that we have only included the funds that we know are coming, with the forecast dropping back to normal levels in 2024. It's possible that transit will receive additional funding through the ART program, which could improve the outlook in 2023 and 2024. However, as with all grant revenue, we do not include it in the forecast until it has been awarded. The next line is utility taxes, which I mentioned during the mid-year budget performance review. And based on the ongoing trend, we have lowered the forecast by $810,000 in 2022 and $833,000 in 23. The forecast for construction permits is now $114,000 and $97,000 lower in 22 and 23 respectively. We met with the building division staff and reviewed projects that are ongoing and in the pipeline. We believe that the construction activity in Everett will remain strong for the next few years. However, permit staff believes that permit issuance will moderate going forward. I believe that council is aware that permit fees are currently under review for adjustments to bring them to current and comparable with other jurisdictions in the region. The current forecast does not yet include an assumption for any rate increase yet. And once that work is complete, we'll adjust the forecast accordingly. We're increasing natural and economic environment service charges by $370,000 in 22 and $192,000 in 23. The biggest driver is plan check fees, which were substantially under budgeted this year, and public safety service charges are also increasing. For 2022, we have them going up by $333,000 and $119,000 in 23. The driver in public safety growth is in engineering inspection fees. We increased the forecast for culture and park service charges due mainly to the restoration of the preschool and tournament fees, and all other revenues, which include small items that both increase and decrease, currently net to a positive $13,000 in 2022 and $45,000 in 2023. On the expenditure side, we start with a reduction in the forecast for Snow 911. This is saving $55,000 in 22 and just under $50,000 in 23. We reviewed the forecast for elections and voter registration costs and believe we can reduce it by $36,000 based on actual costs over the past 5 years. And then, like revenues, we have a catch-all of all other changes in expenditures that consists of many small line items that net to an increase of $115,000 in 22 and $98,000 in 23. The interim bottom line on the balancing list is a remaining deficit of $73,000. But in closing, I'd like to emphasize that we still have the largest items outstanding, including sales tax, B&O tax, labor, benefits, and jail fees. And based on our initial work, I anticipate significant changes in both directions in those items. And so we should finish up the forecast in the next few weeks, and we'll be back for another update in August. And that includes the information I have prepared for today.
Great, thank you, Susie. Let's go down the roll call and see what questions or comments we have, and that starts with Councilmember Bader.
Thanks, Council President. Susie, again, interesting. My question surrounds around that American Rescue Plan Fund. In the previous presentation you gave us, you mentioned that eligible use categories and support local government services to the extent of revenue loss experienced due to the pandemic. And I assume that's still occurring. It certainly occurred in 2021. And I think there were things we didn't do that we would have otherwise done. Actually, it occurred in 2020. What are we looking at there as possible uses to be able to help us with any of this?
Well, administration is currently reviewing some opportunities there for an initial small program to provide some sort of a jump start to get the economy going, some things to help small businesses. And for the larger expenditures, I believe there will be some public engagement to gauge the community's interest in some uses of these funds as well. So that it's still early on that. but you can expect to see more activity going forward. That is, those funds are right now being, the first half that we received are being held in a special revenue fund set aside for that purpose. They're not in the general fund at this point.
Thanks, but nothing specific yet in terms of how we might use them to support our local government services to the extent we experienced revenue loss due to the pandemic.
Nothing at this time, not yet.
Okay, great. I think that's one thing we really need to look at quickly here, especially as August and September will go by relatively quickly, or more quickly than we think, I guess, at this point, and we'll get to that budget decision. So that would really help me to figure out what thoughts I might have further, if any of those funds could be used to make up for anything we otherwise weren't able to do. Thank you.
Thank you.
Thank you. And Councilmember Moore. I think he had to sign off for a work thing. Councilmember Murphy.
Yes, thanks, President Stonecipher. Susie, as always, appreciate the updates. Good information. So two things. One, a question and a comment. On the question part, it was great to hear that we'll be looking at some substantial savings over the next several years with the senior center arrangement at BOA. And I don't know whether or not it doesn't look like you've plugged those in yet. So would we expect that in our next update?
Yes, we were waiting for council to actually approve the contract before we plug that in the model.
Okay, good. Great. We'll look forward to that. And then the second is a comment that's following up on Councilmember Bader. I agree with Councilmember Bader's question and comment that we probably need to be a little proactive with that discussion about how we would sort of spread around the benefits of the ARP funding, the American Recovery Program funding. And when I think about that, I think about it in at least 4 buckets. One would be, how would we jumpstart our economy? So I think that's what we're talking about now with this might be fairly modest and sort of quick hitting program to get some grants out to our small businesses that are still suffering. So that's sort of the first bucket. The second bucket would be our residents. Obviously, many of our residents in town have suffered through unemployment or other, other just ancillary issues that have come through this pandemic. So that's sort of the second bucket is our residents. And then I think about our nonprofits, many of whom have really struggled as their ability to have programming and fundraising activities and all those things have been really hammered over the last year and a half. And then, of course, the fourth bucket, for me at least, is the city's operations. And, so I do agree that there are things that we suffered as a city that we should probably consider at least some portion of these funds to sort of replenish our city for where we took the hit. So, spreading around the bucket of money into 4 smaller buckets makes sense to me, but I recognize that's a decision that we would all have to discuss and talk about and figure out how we would allocate those dollars out. But I do agree with Councilmember Bader that a discussion on that in the next several weeks before we get too far into the budget really does make sense, because those are substantial dollars coming, I think some $20 million, and it'll be important for us to make some policy decisions about how and where we would allocate those funds. So I think at this point, that's my only comments. Thanks.
Thank you. Councilmember Toohey.
Thanks, Council President. Susie, thank you again. I really appreciate how clear and concise your presentations are with all the information. And I just want to reiterate what Councilmember Murphy and Bader said about the ARP funding. It would be sure great and helpful to be able to kind of look at, maybe it's not 100% of the idea for what to do with the dollars, but at least the major recommendations, so we can begin to see if how that affects our thinking for this coming year budget. So, thank you. Thanks again, Susie. Appreciate it.
Thank you.
You, Councilmember Vogely.
Let me just preface this by saying, oh my goodness, I didn't have a chance to write down all the words that need to be said, so I'm going to wing it. Thank you. Let's see. Oh boy. So maybe part of what needs to go into this, maybe we could review the contract that the transit has with community transit, and the if we're going to increase the pilot or whatever and increase the money that we get from Everett Transit, we could increase the money that Everett Transit is making by going to the contract, and I think it's like chapter 26 or something, I'm probably forgetting exactly, but how we utilize the paratransit and the borders in which we transport people that utilize paratransit. So I know that there are a lot of ideas floating around about that, and I think it might behoove us. God, I love that word. I only say it at council meetings. It might be, it might behoove us to take a look at that. I know it's been brought up before, but I'm bringing it up again because I haven't heard it brought up in the past few years on council. So that could increase revenue, and maybe even, within the year. Construction permits, another thing to increase revenue, this is where I started writing down my thoughts, so it'll be okay at first. To increase development of housing and therefore increasing permits and permit fees, even if you're going to raise the rates, we can engage the public now, like through Rethink Zoning and Rethink Housing and with the comprehensive plan, and really develop what are they called? Oh, let's see, I'm going to read from a book. Rather than requiring a time-consuming, unpredictable, discretionary approval process for each individual project, cities should invest time and resources into developing clear rules that apply equally to all projects and then automatically approve the projects that conform to those rules. I know that the cost of delaying projects that otherwise could really, groundbreaking could get started as soon as the permit process is through. If there wasn't all the, oh my goodness, let's get the people involved now that, I'm thinking of Norton. I'm thinking of the Pacific and Pacific Avenue and right over by our offices. If developers knew that they could go to our permitting office and find exactly what it is that they need to follow and then do it, that really takes away the delay and then therefore the equity that needs to be paid back. So I'm just putting that out there. We need to really define and stick with what our permits allow. And that's a large conversation, but it's going to create revenue and it's going to create housing. And if there is just a ton of money from jail fees that could be utilized differently, and considering all of the work that the legislature has done this past year, that our law enforcement leaders are concerned about and therefore our public is concerned about, maybe getting more social workers. I know we now have 3 and that is super awesome. But people trained in like mental health first aid. Because I think what I've been hearing is the fear that police won't be able to go to situations, or will choose not to go to situations where they might not be able to, put their hands on somebody to detain them. Well, our law enforcement in Everett, I have seen quite a few times, do exactly what is needed to detain someone or to get somebody calmed down in a way that doesn't take anybody's, rights away for being handled. So getting more social workers with teams of not just the COET, but just everyone, so that if a law enforcement officer feels inadequate in their ability to de-escalate a situation, they have somebody there that's not in uniform, because oftentimes we've seen that just being in uniform can escalate a problem. So that could be maybe where some money goes. I want revenue and safety. And I think that those are a few things that we can go forward with our budget and with the ARP. And that's all I have right now. Thank you. You do a fabulous job, by the way.
Thank you. Councilmember Roberts.
Well, thanks, President Stonecipher, and thanks, Susie, for the presentation. I appreciated the comments that had been made by Councilmember Bader and Murphy as far as setting this up. I understand what we have before us is sort of a mid-year briefing, so we're taking our temperature as to where we are. I do hope, and I appreciate that this is a question that you wouldn't be answering in the moment, and it may be the council's job to tee this up as well with admin. But I do hope that we, as you said at the beginning of your briefing, we're hoping to have and carry over some of these savings to help keep us going and not make further cuts while we take a look at what we will be asking the public, ultimately, at least in part, asking the public to support in terms of dealing with our budget deficit. So I just look forward to that discussion. And when I say that, I appreciate that the fire district work is still under development, and the same with transit and some of these other elements. But I do hope that we can schedule sooner than later an opportunity to really have that discussion and then figure out what we want to take forward to the public and talk about these longer term issues. So, but thank you for this. This is really helpful information, and that's all I have. Thank you.
Susie, for my part, thank you for this information. I think this is really very helpful. I'm glad to hear that we're kind of digging in a little bit on the jail fees. So much has changed with the way that we're policing, and just COVID changed a lot of things. It makes sense to kind of regroup around what is it, how are we using the jail, and how much is that going to cost us over time? So I'm glad to hear that. I too am interested in talking about the ARP fees. I think they're, there are obviously way more ways to spend those funds than we have funds available. And then we know that the county also has a huge allocation. So it would be interesting for us to understand how they're planning to use their funding, just so that we are coordinating with them. And I don't know, if where they are on the process for that, but I know they're trying to think about how to do that. So there are a lot of pieces in play there, but maybe we could talk about having a briefing just to talk about the extent of the funding and what some of the options for using it are. And Mayor Franklin, did you want to make a comment about the budget or the ARP funding as well?
Yeah, I do just want to touch on the ARP funding. Thank you, Council President Stonecipher. Appreciate all the comments that folks have made. I know it's exciting and an opportunity to have revenue that we can use productively for the city. It's nice to have a revenue conversation as opposed to an expense reduction conversation once in a while. And the ARP funding is a one-time funding. We get 2 installments, 10 million. and then another 10 million. So we have a one-time opportunity to do something pretty transformative for the city. Every training that me and our staff have attended regarding these fundings strongly urge non-operational uses, so that if we were to use it operationally, the funds just disappear. Whereas if we use it in a way to address longstanding challenges or opportunities in the city, we can make a lasting impact. And so I've been meeting with mayors from across the region. I've been meeting with the county. I just had a meeting with the county just prior to this council meeting today. And we as mayors are getting a better and deeper understanding of the executive's proposal for the first installment of their funding, which is $80 million. They get another $80 million, Snohomish County does. So there's a ton of money in the county, and we need to really get a better understanding of what they're going to do with those funds prior to us making a plan for ours. The mayors and I have all kind of discussed that if the county is using these to address housing and homelessness, if the county is using these for economic stimulus, if the county is using these for whatever other reason, then we have an opportunity to kind of fill in the gaps, I guess, if you will, in our own municipalities for where the need is. And in addition to the ARP funds, the county also has access to rental relief, utility relief, housing dollars. There's a whole slew of other buckets of federal relief grants, which are desperately needed for our community, but that will flow through Snohomish County. And so to Councilmember Murphy's really good point of what can we do for our residents, there's going to be many opportunities for our residents to access relief dollars, and we need a better understanding of those dollars before we determine the best use of our dollars to ensure that we can stretch our dollars as far as possible. So our team is working really in close collaboration with all our neighboring jurisdictions and Snohomish County to understand their plans, their proposals, and the other buckets of funding that are not even ARP funds. And then we definitely look forward to bringing some of those big buckets, those ideas that the council kind of mentioned today, to you for kind of just general recommendations that you then can discuss and debate. And we'd like to come up with a public process as well to include our residents and neighbors so that they can weigh in as well. And hopefully that will help us develop a really solid transformative plan for these once in a generational, at least, opportunity for our community. So thank you. I know it's hard but I just let's try to be just a little patient as we work with our fellow jurisdictions and they continue to release new guidance for these dollars every day. So we're learning more every day as well. So thank you.
Thank you. So we've come to the end of our meeting, our formal agenda. If someone from the community would like to provide comments, we encourage you to provide your comments in writing before our next meeting to council@everettwa.gov. All comments received will become part of the public record. Here are the numbers for the next meeting. And at this point, we will recess to executive session for, I believe it was 10 minutes, with a potential announcement to be made following that. continuing our executive session for an additional 10 minutes. We will reconvene here with a potential announcement to be made. The City Council meeting is reconvened from our executive session, and City Attorney Hall, call on you.
Thank you. We're asking council to authorize the mayor to execute an agreement settling a potential claim against the Wilbur Ellis Company related to damage of the greens at the Walter Hall Golf Course. Settlement of the claim would obligate Wilbur Ellis to replace the existing greens with quality new greens. This authorization is contingent on Wilbur Ellis's agreement to language in a release agreement satisfactory to the city attorney.
Do I hear a motion to approve this agreement?
Vogely,
Roberts.
so moves.
Roberts, second.
We have a motion and a second. Does anyone have any questions before we call the roll? Just unmute yourself and speak up. Hearing none, clerk, will you please take the roll?
Councilmember Bader?
Yes.
Councilmember Murphy?
Yes.
Councilmember Tui?
Yes.
Councilmember Vogely?
Yes.
Councilmember Roberts?
Yes.
President Stonecipher?
Yes. And with that, we are adjourned.